Welcome to all of you. I'm happy to be the new group. Uh, I'd like to tell you that I was so happy with the fellowship. I learned a lot from it. What is the role of art? I'm a medical doctor, so I'm not that much aware of art, but I learned a lot from the fellowship. I learned about the role of art, the creative practice of art for mental health, designing a community project, and this is what I did immediately after I did the fellowship. Actually, I did many projects in September to 2021. I did a project with Dr. Manal and Dr. Noha. Dr. Manal, a board member of the fellowship, and Dr. Noha was also with me in the fellowship. We did a program, a workshop for psychological rehabilitation for nurses. Actually, we took this project because we thought that nurses are the forgotten heroes in hospitals. So 12 nurses were included in our project, and they were interviewed and completed a questionnaire to assess their mental health. Actually, 75% they have stress, and 58% they have an anxiety. And we did an art project with them using silk fabrics, wooden frames, art to create self-painted scarves, as you see. During the workshop, they did very nice creation, and they wear the scarves after the workshop. And we can see that our conclusion after this, that the medical team should not ignore their feelings, and same projects should be implemented to allow nurses to cope with what's happening. And actually, we were able to publish this project in the psychosocial rehabilitation. In this project of psychosocial rehabilitation, it won one of the poster presentation winners in the 11th World Association for Psychosocial Rehabilitation and 7th Abu Dhabi International Mental Health Conference in 2021, which is great. And then we did another project because what we saw in nurses was amazing. So we did another project, and this time for the healthcare cleaners, because also they are forgotten heroes. In hospitals, they usually care about the medical stuff and forget the cleaners and the nurses. First, we thought about the cleaners, and we did similar projects. Also, 90% of the participants they have stress and anxiety. Here, they created their own bags this time, and they took the bags with them at home. Some of them they wrote the names of their children on the bags. Actually, what was interesting that participants, they said they never ever had such projects, and nobody asked them about their emotions and how to create them, and they were extremely happy because they think that they are not important in that important in hospitals. So we were very happy, and we managed to let the hospital manager to come and look at what they did. And also, we presented this project of healthcare cleaners at the 14th International Society of Pediatric Oncology Conference in Guangzhou, China, which is also was a great step to publish what we did in art therapy, because we want to show people how evidence-based it is, and really it makes a big difference in people's lives. Also, we did many lectures about the evidence base of art therapy. We did a lecture, me and Dr. Manel, in March 2022 in the conference about art therapy and how it affects the brain, and how evidence-based that it increases the blood flow, helps to decrease the stress, improve the memory, helping chronic illness. I did a project from April 2020 to June 2022 with high functioning autism, because I'm working with special needs too. So 20 children aged 9 to 12, I work with them with the World Bank program to develop social and emotional skills. And actually I implemented art to draw their emotion, do role play with different social situations, and it was easier for them to do this because they can't express their feelings, the high functioning, even if they are high functioning autism and have the language, but they cannot express their feelings. They danced, they wrote about themselves. They created this. This was an example